And I guess that's what the question would be, and that's something that I have observed is, okay, there's been a lot of people saying, okay, let's strike this, let's knock this out. But there is also the question then that arises of what would replace it? Mm-hmm. What kinds of things would you support as far as, let's say that this does get overturned, or let's say that if it's not done by the Supreme Court, it's done in another fashion. Mm-hmm. What are the things that you would support with the healthcare system?
Sure, and I think the biggest crisis, the biggest crisis it presents as a subset of this that people are not aware of is Medicare. Medicare Part A, which is the hospitalization insurance, will be bankrupt, as projected sometimes in 2016 if the Affordable Care Act, Obamacare, is overturned. So that's the insurance that pays for if anybody goes in, that's on Medicare, has to be hospitalized, it pays for dialysis, etc. So that is an immediate crisis that we can predict where in the calendar that's going to hit. And that's what we have to most focus on. And that'd be the subset of healthcare that I would think I could, and it's a major part that I can help with. There has been, like back when my dad practiced, I mentioned, he got paid in cash or in kind for some things. Medicare was developed in 1965. And the consequence have been that it's actually separated many of the relationships. There's become a third party between physicians and patients, and it's usually the government. So as a physician, I can, I take care of Medicare patients. I'm not allowed to, people are not allowed to contract separate from Medicare if someone's on Medicare. So Medicare itself has a lot of bureaucracy tied to it. There's a doctor-patient relation organization that did a survey that demonstrated that a lot of physicians be willing to charge less or separately if they could just get all the paperwork and such out. So I think there is a room for simplification. The whole, generation after generation after generation, actually, physician patients provided healthcare was a much simpler process. I could go on more. There's also, there's some low-hanging fruit in this tree, and there's actually some more difficult decisions that we as a society will have to face as to the expectation everyone can have everything many times over at different hospitals and different places without any, really ultimately paying for it. It'll be very challenging. We can't afford probably to do it in that same capacity. We can make sure everyone gets the care they need, and they're in charge of that, but they'll have to be, tied into that decision process and have some incentives to, make smart decisions with their physician.